Australia's measles failure. This is a very sad situation. Why we let a deadly disease return? Wake up, Australia. Australia once prided itself on eliminating measles in 2014 as officially recognized by the World Health Organization and confirmed by the Royal Australian College of General Practitioners. Yet here we are in March 2025, watching the disease roar back with an alarming rise in confirmed cases across multiple states. It's baffling, it's disheartening, and it's entirely preventable. From elimination to outbreaks. Elimination in 2014 meant no ongoing measles transmission within Australia's borders. However, small outbreaks have been repeatedly triggered by imported cases since then, often linked to international travelers. In 2019, Australia recorded 286 cases, the highest annual count in almost 2 decades, according to the World Health Organization's regional data. Several patients required hospitalisation for complications like pneumonia and encephalitis. Forward to today, 2025, and the ABC News reported 33 confirmed measles cases across New South Wales and Victoria, with scattered cases in South Australia and Western Australia as well. While no deaths have been officially reported so far this year, at least 5 patients have been hospitalised with severe complications, including 1 case of encephalitis. Measles is not just a rash and fever. According to the World Health Organization, complications can include pneumonia, blindness, hearing loss, and encephalitis, and inflammation of the brain that can cause permanent neurological damage and even death. In 2019, a 3-year-old child in Queensland developed acute measles encephalitis after an outbreak in the region, suffering long-term cognitive and motor impairments. A Western Australian teenager contracted measles in 2021 and subsequently developed hearing loss. While no recent deaths from measles have been confirmed in 2025 thus far, the CDC and the World Health Organization warned 1 to 2 out of every 1,000 measles cases can be fatal, especially among unvaccinated children. Why are we seeing this resurgence after achieving elimination? Complacency. Complacency is the short answer. But many Australians believe measles is a thing of the past, so they skip booster shots and ignore their children's immunization schedules. Adding fuel to the fire is vaccine misinformation, spread on social media and alarmingly by a fringe minority of health professionals. According to the ABC and 9 News coverage, public health experts cite vaccine fatigue post-COVID as another reason parents have dropped off the immunization radar. The Royal Australian College of GPs have repeatedly cautioned that even a small dip in vaccination rates can open the door to outbreaks. Measles is a highly contagious disease. One infected individual can spread the virus to 9 out of 10 susceptible people they come into contact. The disease also lingers in the air for up to 2 hours after an infected person leaves a space. When measles spreads, healthcare systems are burdened with contact tracing, quarantine measures, and hospital admissions for severe cases. In 2019, hospital costs for measles-related admission in Australia exceeded $3 million. Australia's 2014 elimination status should have been a triumph. Instead, it's become a cautionary tale. We allowed complacency, misinformation, and vaccine hesitancy to erode years of progress. Now, in 2025, we are back to battling a disease we once had on the ropes. If you're listening and haven't checked your vaccination status, do it. If you have children, make sure they're up to date on their shots, because measles isn't just a rash. It can kill, it can maim, and it's entirely preventable. Stay tuned for part 2, where we expand beyond Australia and compare how other Western countries and developing world are grappling with measles in the face of conspiracy theories, complacency, and unequal access to vaccines. Thank you for listening.